having. What you'll see today is all the advantages of the laser, all the procedures you can do, lots of videos, and how to do these in your practice. So this is the journey we spoke about. We're going to start our journey of dentistry, and so we are so lucky to live in this era right now, to have the laser, to even have the drill at times, to have anesthetic. And so actually back in 7000 BC, we did a lot of research, and this is why a lot of our parents' generation and, and so forth, so on, don't have a great experience going to the dentist. So back in the olden days, basically they used a bow and drill, or this is their drill. They used a bow and a rock to do remove areas of decay. You'll see a little stick at point at the end there. They put it in the area where there's decay, and then they wind it up with their hands and then somehow pull the decay out, all done without any anesthetic. And then you have a clockwork drill. So imagine, a lot of times we're working on patients, you want 10 hands. Here, when we were using a drill back in the 1800s, the drill, you put the little drill bit in, and then you have to wind up the other end to get your drill to work. So that's really no fun for us either. And then now in the 1950s, you have your belt drive, and this is a little bit better. You freed up one of your other hands, but now you have to pump the bottom of the pedal to get your drill to work. So very archaic, very difficult, makes life very difficult and harder for all of us. And a lot of times, as you know, there's a lot of vibration, a lot of these different instruments caused a lot of anxiety, and nobody wanted to go to the dentist. So now we want to go to the dentist and have our kids go as soon as we possibly can get them into our office. They say by the year 1. But now we're actually seeing so many more different types of patients earlier in the practice because of, 1, we have the laser, and 2, because we're starting to identify a lot of different other procedures. So how do we start getting our patients the best possible visit to the dentist? So for example, if you don't have a laser, you start with the front office. You want your initial interaction with your patient to be the best that it can be. The front office starts with a warm smile, the welcoming attitude of every single person who the pediatric patient comes into contact with. You want the smiles, the joy, and the fun of being there at the dentist to get their teeth counted, to get their teeth brushed. And then once they're finished meeting the assistants and the front office, then they'll meet the dentist and the hygienist, keeping that very upbeat, positive experience. And I'm sure we all have that in our office. It's nice that we constantly are reminded to do that, because a lot of times when we come in on a Monday or a Friday, sometimes we get tired, and so we do want to remember that. And it's important for us to always talk to our patients, our parents. So a lot of times parents will come in and they have anxiety from them having bad experiences at the dentist. And so we want to make sure part of our experience and our treatment with our patients is, 1, giving the patients the best positive experience, but also speaking to the parents on the role that they have prior to coming to the dentist. They want their child to have the best experience, therefore they need to enforce that upon their child, knowing that brushing and flossing at home leads to a great positive dental experience. Knowing that any anxiety that the parents have, they need to leave it at home and not bring that over to their child, because their child will know that their parents have anxiety and they'll feel it, and then they won't really want to go to the dentist either. Through a lot of psychology, we know that bribery doesn't help bringing a positive experience for going to the dentist, because usually when you give bribery, it shows that this is going to not be a good thing, so we have to make sure it's good by giving bribes. So much psychology behind it, so that's one of the things that we can hopefully impart upon our parents. And a lot of times we struggle with this, but we try not to let the parents do the dental visit for the child. So many of our parents want to be in the dental operatory for the visit. It's just better, and it helps the child to have a really good positive experience if they're there doing that dental visit. And if it becomes a positive dental visit, they'll remember for the remaining subsequent visits. So laser, this is the acronym for laser, and light amplification by stimulated emission of radiation. This is what we're going to talk about today, and the history of it starts in 1990. So as you can see, we're in 2019. It hasn't been too long because dentistry started way back when. But lasers are definitely something that are becoming more mainstream. You know, we have the diode lasers, which is just soft tissue laser, which more than probably 40–50% of people, dentists are incorporating into their practice. But we really want to try the all tissue laser, and that's what I'm excited to share about, and that's what I've been using since I graduated dental school. So laser dentistry, this is the latest advancement. As we know, we're all trying to be technology advanced. We're trying to get the latest cell phone, the latest iPhone, the latest computers, but you know, why not transfer it over to the way that we practice dentistry and having the latest dental technology, which would be in pediatric dentistry, it would be lasers. In general dentistry, it would be same-day crown machines. We all have, by now, digital x-rays, which was one of the more latest and greatest. So we definitely know that, you know, whenever we incorporate something new into our practice, any new technology, we want to make sure it is supported by the AAPD, which there are so many different articles, journals, that the AAPD definitely does support laser dentistry for ourselves as clinicians and for our patients. So what are the benefits of incorporating laser dentistry into our practice? We want to minimize pain, and we can definitely utilize the laser to do that. And we want to give more comfort to our patients, and we want to provide less fear and anxiety. And these are things that the dental laser can help us with. And then there's clinical studies show that 90% of all patients who require dental treatment don't require anesthetic. And so that comes with us as clinicians being very adept with our laser, but we can definitely get there. And you know, when I first started with the laser, I was probably 80% no anesthesia, but now I'm definitely more than 90%. So we can definitely get to that point where if you want to provide no shots for your patients because of the fear and anxiety that they have, we can definitely get them there. And we can definitely get you there in terms of being one of those types of clinicians. So these are the advantages. It's causing less pain for your patients because if they don't need the anesthetic, then they're not going to have that shot discomfort. And then if you have patients who have high anxiety to the use of the dental drill, you can eliminate that by using the laser. We can definitely minimize bleeding and swelling when we're doing frenectomies, gingivectomies. You can do all these types of soft tissue treatments without needing without having a field of blood. And so it's really nice that you're going to get a bloodless field, you're not going to get any swelling. Post-operative care is going to be so much better for your patients. When we're doing tooth removal, this is a minimally invasive, non-invasive type of treatment where you only remove the area of decay that you see. So gone are the days of GV black where you have to do a dovetail to get retention. Your laser will give you micro retention on its own. So it's great that you just remove the area of decay that you see and then you close it up. Lasers can be used on composite fillings. So basically, if you have an old filling that's leaking, you can definitely remove that very quickly. So there is some changes to your practice if you're feeling like, well, there's so many advantages, what are the disadvantages? And so whenever you incorporate something new, you do have to end up having a little bit of time to learn it. So there is a learning curve. Learning curves are about 2 to 3 months, we find, for a lot of clinicians. But the more that you incorporate the dental laser into your practice daily, turning it on, trying to utilize it on every patient, you'll get faster, better, and you'll hit that mark where the laser is just a part of your practice. It's no longer this new learning tool. New technology always has a startup cost, but luckily for utilizing the laser, the ROI on it is amazing. It'll pay for itself and then bring you worlds of more benefits. And then if you're using a diode, you do have to have specific eyewear for soft tissue laser. For the hard tissue, you definitely need eye protection, but not to the point where it's one of the darkened glasses. So here is one of the lasers that we use in our practice. Mine's not as cute as this one, but you can definitely have different pictures on your laser. But whatever, it's nice if you have a laser, you can customize it to how your practice looks. So this is our Waterlase all-tissue laser. We have 3 of them in our practice. So as you know, we definitely love using the laser. It gets used all day long pushing from one operatory to another. So hard tissue procedures, it's the bread and butter of what we do. Every single day we see caries, so it removes it. And then every now and then your patients come in, they waited too long, their decay has gone almost into the nerve. So how do we fix that? We have to do some pulp capping. And then sometimes your decay is just too big. And now we want our patients out of pain, so we need to go and do a pulpotomy. And then we need to disinfect the tooth. Laser has great benefits, does all these different procedures, and does it honestly, with a lot of research shown, better than the traditional drill, the form of creosol, because it's much more, in a sense, organic than all the different things that we've been using. So we have some animations of different types of procedures we've been doing. This is one of BIOLASE's Class 1 procedures. So what BIOLASE has is basically lots of videos that can teach you how to do these different procedures. Let's see, it's supposed to play. But so there's classes, once you have the lasers, there's classes that you can take that'll teach you how to do all these different procedures. And then, but we also have lots of videos that BIOLASE has created. And then I've tried to do some of my own videos too. It's pretty difficult sometimes working on patients and doing them. But if you need to know how to do different techniques with different procedures, there's lots of videos that show that. So BIOLASE has Class 1s, Class 2s. I'm trying to show the Class 1 right now. Maybe click that. So maybe, can you exit? I do want to show you guys, and then scroll down. And then how about click here? Oh yeah, click that. You just have to wait. Okay, good. Okay, so here is an example of a primary Class 1. This is the technique. So the technique is going to be different from what you're used to. With your drill, you take your drill bit, you touch the tooth, you have your tactile sensation. That's what we were taught when we were in dental school. But basically, my first Class 1, Class 2 in dental school took me about 8 hours. I know, it took me forever. But, and yeah, that was the technique back then. You touch the tooth, you drill. So luckily, you know, with lots of practice, lots of years under my belt, lots of experiences, you know, my Class 2s aren't as slow anymore. But now you incorporate a new technology. This new technology says, hey, hard tissue, you can't touch. You have to hover 1 to 3 millimeters above the surface of the tooth, be perpendicular to the surface you're cutting at, and then start to cut. So then you're kind of like, well, that seems kind of difficult for, you know, changing my mindset of how to practice dentistry. However, with practice, experience, and, you know, the drive and the want and the passion of wanting to get to that point, you will get there. And so now for me, you know, laser fillings take a minute. You know, I'm faster with the laser than I am with the traditional drill when the patient sits in the chair to when they leave. Because one, you eliminate 10 to 15 minutes of anesthetic time and them getting numb. So, you know, these videos definitely show you the angulation, the technique. And so, you know, you watch them, then you practice. You know, I used to spend hours outside of my dental practice just trying to learn and make sure that I would be a better laser dental clinician. And so with a lot of perseverance, I believe, you know, today I'm definitely to the point where I'm comfortable. All right, Matt, let's see. Let's go to the next one. Perfect, thank you. And so here's an example of a primary Class 2. You know, the patient came in with a really big area of decay. And then with the laser, we removed all the infected areas. And this is also done without any anesthetic. So I can tell you with primary teeth, I'm pretty much 99% no anesthetic, whether it be a Class 1, Class 2, no matter how much the depth of it, I can pretty much get it there. For an adult patient or a permanent tooth, my percentage is probably around 90. But it also depends on the mindset of your patient. If your patient says, no, I don't want to feel a tiny, teeny, tiny little thing, then you should numb your patient. But when you numb your patient, you use the laser to create the benefits of it. You know, it creates retention while you work, it sterilizes the tooth while you work, it doesn't create microfractures the way the traditional drill does. So, you know, you can definitely utilize the laser for all of its benefits, even when you numb your patient. I use an Ultradent Toffelmeyer band. It doesn't hug the tissue or impinge the tissue as tightly as the traditional, so that works really well with our patients. So if they don't have to get numb, they don't have that discomfort from the band. Okay. Yeah, maybe you can show them this one too real quick. It's supposed to. Okay, thanks. Okay, so here it is an example of a class 2. So I really do love the laser for the class 2. Why? Because our laser tip is end cutting. End cutting means that only the power comes out to the at the end of the tip, and there's no power on the sides. So what does that mean for us? You're not going to nick the tooth next to it. So if you don't nick the tooth next to it, that's how you're giving your patient the very best care you possibly can. You're not going to drill on the tooth, accidentally nick the tooth next to it. You're definitely going to be very precise about the area of decay you're removing, and you can be very conservative. And so that's the best part of doing a class 2 when you're using this end cutting type of sapphire tip. So you can see here we're just doing a little slot prep, very small area of decay, which is nice that you don't have to go in and drill a whole class 2 with a traditional dovetail. You don't have to accidentally nick the tooth next to it. So your patient is definitely getting the best care in terms of this one particular filling here. So end cutting is very beneficial for some of us who can, you know, maybe accidentally impinge upon the tooth next to it, or if your patient moves, you're definitely not going to cause that problem to healthy, sound tooth structure next to it. Okay, so we'll keep going here. So lots and lots of benefits. Your patient is comfortable. When you utilize the laser, there's less heat. When you utilize laser, there's less pressure. So the drill obviously kicks up a lot of heat. The drill creates a lot of pressure. There's no vibrational sense for the patients, and so a lot of our pediatric patients don't like the fact that they're feeling a lot of sensation. A lot of pediatric patients don't like to feel anything, which is part of the reason why I decided that I'm going to try this laser, because all of these things I can eliminate with the drill. We can have less sensitivity. A lot of times the laser will desensitize the tooth for the patients, and you have the ability to do less anesthetic. So healthier teeth we spoke about, because you're not going to nick the tooth next to it. Less appointments. A lot of times if you have a compliant patient, you can do multiple teeth in one visit, so you don't have to keep bringing your patients back. If your patient's not numb, you check their occlusion accurately. They can let you know whether it feels weird to them, different to them, so that helps not having to bring your patients back for bite adjustment. You're minimizing damage to the surrounding tissue. That's what you noticed when we did a class 2. Preserving healthier tooth structure, you only remove the area of decay that you see. And through years of research, all this scanning, the SEMs, there's less cracking of the healthy portions of your teeth. So you're getting less microfractures for your patient's tooth. A lot of times procedure time becomes faster. So the more adept you get the laser, you can definitely work faster, get your patients in and out faster, providing them a nice experience, because patients don't like to sit in the chair that long. And so if your patient doesn't have to get numb, then they can talk, eat, and function much more effectively. So this gives us as clinicians a peace of mind. And it'll give your patients and the parent a peace of mind too. Here's an example of a class 3 before, during, and after. So I only removed the area of decay on the right and then filled it right in. So very simple, no anesthetic necessary. This is the only tool that you can use that with one instrument you can switch from soft tissue to hard tissue. So this was also done without any anesthetic. It's a class 5. One tip we use. Removing the soft tissue, it's nice. You can see here there's no bleeding involved. And so, because if there's a lot of bleeding, you'd have to either pack cord, you'd have to do some viscostat. Viscostat can unfortunately, sometimes contaminate the area, but with one instrument here, we can remove the tissue, access our area of decay, switch from soft tissue mode on our laser to hard tissue mode, and start to remove the area of infection. Once you see you have a really clean field of vision here, you can place your filling, and then the tissue will just heal right back. And all this is done, no anesthetic, very great positive experience for our patient here. Only tool that you have in your practice that can do hard and soft tissue with one instrument, one tip, and just one button push. Here are some examples of soft tissue procedures that you can do in your pediatric practice. Maxillary frenectomies, definitely one of the biggest topics in society right now is maxillary frenectomies for newborns, breastfeeding, and which is something that we've definitely incorporated into our practice. And then lingual frenectomies for patients who are having trouble with speech impediments, growth and development, and also newborns for breastfeeding. Operculectomies, you know, a lot of times you get a lot of excess tissue over the area of the second molars for the patients. With, you know, some topical and the laser, you can remove those in less than 10 minutes. You can help your orthodontist out by doing exposure of teeth, gingivectomies, biopsies. Some of our pediatric patients come in with Apnea ulcer lesions. You can help cure that for them within 10 seconds. It helps them heal within a day versus a whole week, and then you'll get less recurrence of those Apnea ulcer lesions. If the patient bleeds a lot from your extraction of a primary tooth, you can do coagulation and hemostasis for them. So what are the benefits of why we're using this laser to do these soft tissue procedures? You're going to get faster healing. Frenectomies heal within a day or two versus 7 to 10 days with the traditional scalpel. You're going to get less chance of contamination or infection because the laser is sterilizing while you work. You're going to get less swelling, less bleeding. As you can see, a lot of times there's next to no bleeding, and there's less appointments. So here's an example of pulp capping. So very easy to do. Maybe it's working out now. So basically, if you have a patient who didn't brush, then all of a sudden had a big area of decay, you access their tooth for all the infected areas, and then you get a bleeding area. You can use the laser to stop the bleeding and help stimulate the secondary dentin area. So what's nice is the patient, one, potentially you've eliminated a pulpotomy for them, but you just let your patient know, you know, this is a 50-50 chance. We're either going to save your tooth till it falls out, or potentially you need a pulpotomy. But at least you have this tool here that you can give that patient that extra life in the tooth, potentially not needing a pulp and crown. So you can see the treatment's about 5 seconds. The area of infection, you just laser, and then you're done. Here's an example of the pulpotomy. So for pulpotomies, you definitely want to numb your patient. This is something that can be obviously not very comfortable. And so pulpotomies, you numb your patient, you use laser to access the area of infection, and then in lieu of formocreosol or maybe little endo tips, what you can do is go in, remove the infected pulp tissue with the laser, and then help stop the bleeding, remove all the infected areas, and then fill it in the way that you normally would. We use, what do we use? I forget now. But anyways, I don't do a lot of pulpotomies, but if I do once or twice a year per se, we definitely utilize the laser for that. So it's a great way for you to treat your primary patients, not having to utilize, you know, the different toxic materials that we were taught back then. So that's an example. And then Apnea ulcer lesions, you know, definitely kids bite their lip or tongue. Sometimes they're in the sun too much, or they just eat different foods that cause these lesions to come up. We have a lot of adult patients in our practice who have these lesions, and so we love the laser for this. Basically, it's a super easy procedure. You find out where your lesion is, you circle the lesion, and then you color it in 3 times. So that's pretty much the extent of lasering an apnea lesion with the laser. It's really great. You're killing the most disease layer. So it's one of the funnest procedures you can give to your patient. Do you have a question? The setting that we use for this is 1 watt and no water, 15% air. Yeah. So if you guys want settings later or how we do these different procedures, definitely text, call, email me, or just ask me right after. But I definitely have all the settings for you. Okay, let's see here. Where am I? Okay, next one. So frenectomies. These photos were done before I started doing a lot of frenectomies. This is the very beginning when I first started utilizing the laser, and I was like, frenectomies, you know, with the scalpel or scissors, not something I want to do at all. Because when we did it in school, it was a lot of bleeding, sutures necessary. And then what happened was I started learning how to use them with the laser. And as you can see here, the before and then the after. And this is immediately after too. So you can see what a great procedure that you can provide for your patients. There's no bleeding. You know, we did all this without any anesthetic. So it's a really fun procedure that we can start providing for our patient. So that one, this photo here was on, I think, a 4-year-old. This one is now on an 8-year-old. This one was referred to us by our orthodontist. She's also a patient of ours, but she kept getting a gingival pull around number 8. And so every time she would speak or lift her lip up, it would pull on the gingiva there. So she was definitely on the track of getting recession. And then as you can see, she has a diastema between 8 and 9. So we wanted to help her, and the orthodontist wanted to help her. We gave her the best frenectomy that we possibly could. This is immediately after, and there was no bleeding at all. I could see as much as I wanted to remove. I basically remove until I get to a diamond shape. And so halfway through our procedure, thanks. Thank you. So halfway through our procedure, the patient was doing great. No anesthetic, a super great patient. She's like one of our favorites. We're like, oh, we should tape this. So it's only halfway through. But so the strokes that I use are basically, I'm right in the middle of the area, and then a lot of horizontal movement, some vertical movements to open up and release that frenulum attachment. But it's so pretty. You know, you can do all this, no suturing, no anesthetic, and the patient had no discomfort at all. We asked her, we made sure she was okay. I do use compounded topical though, and so we have the best topical ever that we use. But you know, when you're working in a bloodless field, you can see everything that you're going to remove, so we love that. So yes, for the frenectomy protocol, we place compounded topical. Using glucose means that something that we can utilize on our newborns. When I do frenectomies, I'm at 1.5 watts, and I use brush strokes, and I release until I see a diamond, and then I always see my patients 1 week post-op. I don't score the bone. No, I don't. Yeah, we've never had reattachment, and I've been doing it for like 13 years now, and we still see those patients, and they have not had reattachment. So I don't like to score it to the bone because I realize I don't need to, and I don't get that reattachment. So why do we use lasers on these soft tissue procedures? There's no sutures needed. Secondary intention healing, we get barely any bleeding and very little post-op care. You won't get your patient's parents calling about why this is happening, like what, you know, like fevers and different things like that. It's just one of the best things that we can utilize for. So, you know, if patients have lip ties, they also potentially have tongue ties. Play that for me, Matt. Thank you. So here's another no anesthetic tongue tie frenectomy. Different tips that you can use for doing frenectomies. There's the typical Z6 tips that we use on a daily basis, but a lot of us, when we do frenectomies, we do like the C3. So if you're a newer user, you want to use the C3 tip. It's a chisel tip, so you get more surface area to cut the frenectomy. This is all done live here. As you can see, there's no anesthetic, there's no bleeding. You can just gently see basically the release of the frenulum, and then you're going to get that diamond. So it's a really fun procedure once you start doing it. doing more and more of them. And it has so many great benefits. And one of the biggest topics of today is just in terms of the benefits of releasing frenulum, like tight attachments. So if you can utilize this in your practice, incorporate this, and start to do these more frequently, you'll really start to enjoy them and provide that better patient care for your patients. So before I had the laser, I actually would see a lot of tight frenulums, but basically when we see things that we don't really do, we just turn our heads and we just pretend that they're okay. But now that we're able to identify them and make all these things better for our patients, it's a really great benefit. So you can see here basically the entire visit, no anesthetic, no blood, and patient had more mobility, can stick their tongue out beyond their lips. This is a lingual frenectomy on a 3-year-old. I think it's a 4-year-old, the same one that we did the maxillary tie on before, and this is immediately after. So you can see how it's just very pretty. So lingual frenectomies, maxillary lip ties. So what are we looking for? Why do we even think about doing them in newborns? So I had the opportunity to be on the clinician side this past decade, but now this past year I was able to be on the parent side where my son was tongue-tied. And so crazy because prior to when he was in womb, I was like, wouldn't it be crazy if my son had a tongue tie? Who would do his frenectomy? And I was thinking, no, we can't think like that because, you know, that's not going to happen. And lo and behold, when he came out, he could not latch, could not breastfeed, didn't want to eat, had very low weight gain. And basically, I sent this picture to a pediatric friend of mine, and I said, does this look like it's tied? And I was hoping he would say no, and he said, that kid is so tongue-tied. So I'm like, oh, great. So I had to figure out who was going to do his frenectomy, and then in the end, Susie, my assistant, and myself did his tongue-tie. So I looked around for all my frenectomy pediatric friends, and no one was utilizing a hard soft tissue laser, which I believe is honestly the best thing that we can do utilize on our patients. So I did it on my son. So TOTS, that's a huge topic right now, tethered oral tissue. You'll read so much and see so much in literature about why in the world do we do frenectomies on newborns? Why should a 2-day-old baby go to a dental office? Well, one, when you're in the hospital, we were in the NICU, we were, you know, with a pediatrician, they just don't identify them. And honestly, I think because they don't do them that often, they refer you to an ENT, or they just think that you need to work with your lactation consultant more and more and more and work at it, even though, unfortunately, physically, you know, the more you work with your lactation consultant, it's just not going to work if your child is physically tongue-tied or lip-tied. You're going to have a lot of problems when you have these tethered oral tissue, whether it be in the maxillary region or the lingual region. So why do we do these revisions? We want breastfeeding improvements. So my son, who was breastfeeding from 5 minutes long after his tongue tie release, went to 45 minutes of breastfeeding time. We want better facial neuromuscular development. When your tissues are tight and it brings back your facial jaw development, you're never going to allow your facial bone structure to develop and grow properly. So that's why we want to untether these oral tissues. Brain development, you know, that's a big thing. Milk production. If you're not able to breastfeed your child, your milk production is going to go down. And that's one of the biggest things I learned about being a mom. Basically, if you have this intention of breastfeeding your child, and then you're going to work as hard as you can, but for some reason your child can't breastfeed, then what do? Basically, you can give up, which means that once you give up, there's no more milk. And then the less time that your child breastfeeds, then your milk production goes down. So if we revise those tethered tissues, then you definitely will increase because your child is now able to drink more. Breathing helps a lot. If, you know, when they're tethered, then their tongue is inside their oral cavity, they're going to have a lot of reflux. And then a lot of times, you know, if you know that you're able to do the best for your child, you're going to have the best maternal well-being. So who's diagnosing these things? As I said, basically your your NICU doctor or your pediatrician, a lot of times they are not diagnosing these. And if they do diagnose them, my friend just had one diagnosed by her pediatrician. She had it done in the hospital with the scissors, bled everywhere, and in the end, they didn't get a good tongue revision. So, and actually a lot of research shows if you do a tongue tie with the scissors or the scalpel, you'll definitely get regrowth. And so now it's upon us, and luckily a lot of lactation consultants are seeing a lot of the necessity for all these tethered areas, and so they're referring them to a lot of pediatric dentists now and general dentists who do see newborns. So you can definitely build a whole new area of practice within your practice of treating all these tethered infants. And honestly, it's very easy of a procedure to do as long as you're prepared for it and your team is prepared for it. So definitely something you want to incorporate and find out. Dr. Kotlow is very big into tethered infant tissue area, and he's one of the pioneers of it. So he's the one who definitely looks for these things. So I recently took a class from him, and he was an inspiration because he really has a lot of passion about it. But as you can see here, you can start to identify. The more you see things, the more you're able to know, is this patient truly tongue-tied? So there's different classes, class 1 through 4. When you get to class 4, that's definitely tied. So this patient on the lower right corner has a maxillary class 4 tongue tie. So the attachment is into the hard palate and the patella area. So if you leave this, as a newborn, the patient will have a lot of struggle in terms of breastfeeding. So with less than 5 minutes of everybody's time, you can make that so much easier for your patient. These are all different examples of the class 4 infant lip tie. This patient is older, didn't have the ability to do it as a newborn, and you can definitely still breastfeed, bottle feed with ties, but the patient is no longer suckling the milk. So the child has to figure out how to get the milk out. Definitely will probably get it, but not as efficiently as if you had done a release for their lip tie. So untreated tongue ties, what do they lead to? They can lead to malocclusion, lots of periodontal disease in the adult future. It can interfere with orthodontic care, and that's one of the reasons why we did the 8-year-old lip tie, because the orthodontist knew that it was going to be a problem for him. Speech articulation problems, sleep apnea. A lot of patients who are tongue tie have major sleep apnea, and that's one of the biggest topics today for children. Because a lot of times kids clench or they grind their teeth, and we're always wondering, oh, well, that's just one of the things that happens. But actually, they're having a lot of apnea, and so that's why they're grinding. If they're tongue tie or lip tie, they have difficulty chewing, swallowing foods. They can develop high maxillary arches, and then, oops, sleep apnea twice. So here's some classifications of now a tongue tie. And they also go through classifications 1 through 4. And 4, as you see here, being complete tongue tie. And so you can figure out how much range of motion they have by having them open when they're older. 12 to 16 millimeters, 8 to 12 millimeters are pretty good. Once you get into basically non-opening of 4 to 8 millimeters, 0 to 4 millimeters, you definitely want to discuss releasing that tie for them. So more problems with the wait and see approach. The decalcification and sizal caries starts to happen. When you get a maxillary lip tie and the patient you can't get in there to brush your child's teeth, then the milk will pile and the food piles up between those E and F teeth. And so those areas of decay start very, very early on due to that tethered tissue. If you have class 3 severe tongue tie, that has a lot of problems. Patients have undue stress. Maybe some of their friends can stick their tongue out, lick a lollipop, eat ice cream. Your patient might not be able to. The diastema, I guess in different countries, diastemas are cool. In America, sometimes we feel like diastemas should be closed. And a lot of times when the permanent teeth start erupting and your tissues are tethered, all those teeth will come in, will be pushed laterally. So here's an example of all the tongue ties that you potentially could see. A lot of times when you're seeing this, you're looking for, you know, heart shapes, V shapes, basically not being able to open. The left side shows how tethered this patient is with his tongue. When they cry, you'll see a V shape. You'll definitely see a heart shape on the right-hand side here. These are what you're looking for if the patient is tongue-tied. So you can have them cry, you can have them open, and this is how you can help to diagnose whether your patient is tied. So advantages, when you're 0 to 2 years old, why do we do them? Because we want our patients to breastfeed. We want them to not be apneic. We don't want a lot of air, gas, inflection. So a lot of patients, parents will come in and tell us, you know, when my child eats, you know, all the milk comes out the side of his mouth, or he's very gassy, he's inhaling a lot of air. So you can definitely eliminate all those things by just doing a very simple lip tie. And then as they get older, ages 2 to 5, 2 to 18, the oral hygiene will be better, their aesthetics will be better, speech will be much better, skeletal development, palatal floor, sinuses, all these psychological developments will be much better if you start to identify these things and help your patients through it. Here's a 7-week-old baby with the symptoms. Basically could not latch at all. And when he could, then he would have lots of air, very gassy, had very low weight gain, just could not figure it out for himself. And so what we did was we did a frenectomy, a lip tie release for him. What I learned recently was, so we use compounded topical when we do the lip ties and the tongue ties on babies. But I have, you know, we definitely have great dental assistants who know to suction, make sure that compounded topical is not swallowed by the patient. But if you're concerned about using compounded topical on patients, you can use something called Sweetums. It's 24% sucrose solution. You have them have the infant ingest it just right before the procedure, and this is what helps them through the pain, and if there is going to be any pain for your patient. So if you're not wanting to use compounded topical, the other option is sucrose solution. They utilize it in the NICU, in the hospital. This is definitely what they give patients before circumcisions, needle pricks, from ages 0 up until like 15 months. The company is called Sweetums. You have to buy it directly from them. Yeah. Another thing that you can offer to your parent, patient after they leave, is something called a Jolly Pop Pacifier. So if it seems like it was a rather difficult procedure for the patient, or the patient was crying a lot, there's a pacifier that has the sucrose on it that you can send them home with. And so that adds comfort after a more traumatic, or after a procedure that may seem traumatic. So the topical we use, it has to be compounded topical. For any soft tissue procedures, whether it be for the newborn here, it's called the best topical ever. We used to use, there was Profound, there's Tax 20, but now all of those you have to, they're more regulated. So right now, best topical ever is not as regulated, but it's actually one of the better, it's even better than the ones that we were using. So this you order from the actual manufacturer, best topical ever. And just whatever area you're working on, you only use a small amount. Small is better, because otherwise, if you use too much, you'll get sloughing, or the patient will swallow it, and it's very profound. And so they'll feel like they just can't swallow. Yeah, they'll feel like they can't breathe. And nothing closes up. They definitely don't, it's just a sensation or a feeling. So a small, less is better. So these are two things that definitely will help you through these soft tissue procedures. And so this 7-week-old baby came back. We did 1 week post-op, and you know, you can see he's definitely no longer tethered. So this is one of our best success stories. So like anything that we do in dentistry, or, you know, we are all definitely clinicians who like research. And so through the Journal of Pediatric Dentistry, there are many articles. But here's just one of the articles that I pulled up that I utilized a lot of my information from: types of lasers and their applications in pediatric dentistry. And these 3 pediatric dentists are the ones who did tons of research on laser dentistry in order to come to the conclusion that laser is great in pediatric patients and has many advantages, benefits. The conclusion was basically it's suitable alternative for many conventional procedures in pediatric dentistry and pediatric dentistry. The diagnosis, removal of caries, it works with pulp therapy, decreases the risk of infection, swelling, inflammation, reduces the bleeding, all the things that we did talk about. And then it even goes into the fact that children are often more cooperative when laser is used for dental treatments. So on top of being very experiential with our laser, research shows from these dentists, and there's more than just this one article that I found. I just didn't put all of them up, but definitely research shows that by utilizing the laser in our practice, we can give our patients that best dental experience. So these are the trends for laser usage. We're growing our practice. We're growing our practice because we're doing more procedures, we're meeting more patients, getting more internal referrals. We're efficiently treating them with everyday conditions. You don't need to incorporate new procedures if you don't want to. The laser will do all the procedures that you've been doing on a daily basis. You're going to definitely see an influx of new dental patients in your practice, because who doesn't want to have new technology? Like when we had LASIK surgery, we wanted laser surgery on our eyes. When we go to the dermatologist, we want them to use lasers to remove our moles versus like the scalpel to cut off our moles. So why wouldn't we go to the dentist who uses laser to make our dental treatments much better? And a lot of times we're getting increased case acceptances because now we're able to meet the needs of anxiety patients, or basically we have more things to offer our patients who come from a multitude of different experiences. So our practice benefits: lasers can decrease dental anxiety. The dental experience can exceed your patient's expectation, and that's what we're always looking for. And then decreasing the need for anesthetic, and then decreasing the need for drilling. We're definitely getting higher patient comfort for all these added benefits. And we're being better productive doctors too by doing all these different things that can make our practice better. So just to wrap up, basically these advantages of laser incorporation: remember, you can have minimal to no anesthetic. You can have minimal bleeding when you're doing soft tissue procedures, more controlled swelling, reduced post-operative infection, less chance of infection, and reduced time at the office. I mean, a lot of our patients love coming to see us, but they definitely don't want to hang out forever. So some of our patients are, they were to the point where they've associated the drill with a very bad experience, so now you can use the laser versus a drill. There's no absorption of harmful chemicals. You can, if you need to, you can eliminate formocreosol and use the laser to sterilize for the pulpotomies. And improves the bonding process, because now you no longer, you get the micro-etching of the tooth, so that's why we don't have to remove extra tooth structure to get retention. And then we're getting quick removal of tooth decay by utilizing that laser. Our lasers last longer because the laser sterilizes while it works. You're not going to get secondary infection. We're healing faster. A lot of times, with the frenectomies, the patients can heal in a couple days versus a couple weeks. We're preserving the tooth structure. We're getting a more sterilized environment. And the canker sores, our biggest success is basically laser and canker sores, getting patients out of pain that same day or the next day, and then the canker sores getting eliminated within those days. The patient no longer has to walk around for a week or two with the canker sore. And all of our patients have said that their recurrence of their canker sores, they used to get 10 times a year, now it's down to 2 or 1. So we really love hearing that feedback. Even more advantages, you're getting precise removal of diseased tissue. And you're definitely, when you're working with the laser, you're very focused on that area. And so you don't have to remove more tooth structure than necessary. The laser doesn't have the heat, the vibrations, so you're getting less thermal necrosis. And these are all proven with years of research. No sutures. The best thing about those soft tissue procedures, they don't have to leave with sutures. They don't need to come back in a day or two if the suture gets loose. So we love that. And then reducing the operator time. So what's our ROI? This is just a very quick little thing. So if you're doing a laser frenectomy, once you get adept at it, 1 minute. It really doesn't take too long for you to untether that tissue, because the tissue is thin. It has no nerve endings. It's very easy for you to take that laser and release that tight frenulum. Takes a minute, you know, you need 5–10 minutes to explain to the parent, have the patient in and out of the chair, but basically you can make 500 for that procedure. A 1-tooth gingivectomy does not take long. You can charge $95, you can do operculectomies, you can do fibroma removal. So within your day, all these different procedures, if you weren't already doing them, frenectomies, gingivectomies, operculectomies, fibroma removal, you can increase the production of your practice.
You have the dental code, but people who have insurance, they don't want to pay out of pocket. They say that if insurance covers, then you want to get it done.
Then I'll do it, yes.
If they're not in pain. If they're paying, that's a different story.
Yeah.
But it has to be something that you can send it to insurance and collect some copay.
Correct, yes. There are dental codes for all these. And then Nick in the back would definitely have them for you. Yeah. So our ultimate goal. So why are we here as clinicians? Why are we here as dental team? And why do we want to see our patients have a great dental experience on a daily basis? Because we want to provide the very best. We want to make sure every single patient, when they come in at 2-day-old, 95 years of life, we want to make sure their dental experience is the very best that it can be. My journey basically was to incorporate laser dentistry into my practice so I could provide that. Of course, all the other procedures we do are definitely a great way to treat our patients, but at the same time, I love incorporating new things that I can become a better clinician, meet other clinicians, so I can make new friends in the dental world, but at the same time, making sure that every patient of mine hopefully leaves our dental office with that much better positive experience. So we've incorporated making sure our patients come to see us, you know, at age 1. Otherwise, they come earlier if they have tethered tissue. And then at the end of the day, we want that non-traumatic experience, knowing that we've provided the very best. So everyone smiles in the same language, whether you're a puppy or a person or an infant or a little fishy. You know, we're all here as dentists to provide smiles on a daily basis. So thanks for coming today. I appreciate your time and just spending your Friday with us. If you have any questions, then definitely ask. And then there's a laser lab right behind us. So if you want to utilize the laser and if you have any questions on specific procedures, we can definitely help you too. Okay, thanks.